Good morning, students. Today we are going to discuss about nutritional assessment. This is coming under the health assessment that already we have discussed. So, interaction of nutritional status means the nutritional status of an individual is often the result of many interrelated factors. So, through the nutritional status of individual, we can find out or we can relate it to other factors as well. So it is influenced by, so nutritional status is not only the intake of food of an individual, but it influence or it makes the food intake and quantity and quality and physical health. So nutritional status means we are checking of an individual of how much food intake and the quantity of food the individual is taking and the quality of the food and the physical health. This all together calls as a nutritional status. The spectrum of nutritional status spread from obesity to severe malnutrition. So, in these influence factors like food intake, quantity, and quality, and physical health, that can lead to obesity or to severe malnutrition. It depends upon the intake of food and quantity of food and quality and physical health. So, what and all the purposes of nutritional assessment means? It is mainly about the diet intake and body compositions compared to normal individual. So how much diet intake like food intake and what is the body composition it compares to a individuals, normal individuals. And next one purpose is for body composition reflects calories and protein needs. So when we do the nutritional assessment only, we can find out the body how much it requires, the calories and the proteins how much it requires. And next one is nutritional status predicts hospital morbidity, mortality, length of stay and the cost. Through the nutritional status we can predict the hospital morbidity, the disease rate and the mortality, that is the death rate, and the length of stay individual or the patient how much like how long they're staying in a hospital and what is the cost. This thing we can predict through the nutritional assessment. And next one is baseline body composition and biochemical makes determine if nutritional support is effective. So through the nutritional status or through the nutritional assessment we can determine how much nutritional support is effective, whether nutritional assessment or nutritional status is effective or not. That also we can determine through the nutritional assessment. Next one is medical and social history. So mainly this, as already we have studied in the history collection, so mainly medical and social history gathered from the chart of the patient or through the interview with the patient. So first one is medical history. So medical history we are checking like diagnosis, past medical history and surgical history, and then previous uses of medications and alcohol, drug uses and bowel habits, that we are checking in the medical history. And then next one is psychosocial data. So psychosocial data, economic status and occupation of the patient and the education level, living and cooking arrangement and mental status, everything we are checking on psychosocial data. Then others, what we are collecting history means age of the patient and the gender, sex of the patient and the level of physical activity and daily living activities. This all coming under the medical and social history. Before you're doing the health nutritional assessment, you need to know the medical and social history. Next one is nutritional assessment method. So when we are doing the nutritional assessment, for that we have some methods. Okay, those methods are, first one is anthropometry. Okay, this is the methods that we use for nutritional assessment. Next one is biochemical evaluation, and then clinical examination, dietary assessment, ecological study, functional assessment, vital and health statistic. These seven are the methods of nutritional assessment. We are going to discuss details about these methods. First one is clinical examination. So clinical examination also a nutritional assessment method. So what they does means, in clinical assessment they assess the level of health of individual. So what is the level of health of an individual, of a group, in relation to the food they consume. So it is about the assess the level of health of individual or the group relation to the food they consumes, like same food, how what they are taking the food intake, that how what is the consume means how much they are intaking, the what is the food they are taking. Okay, as for that we are assessing the level of health of an individual or a group. And next one is simple, easy and most practical. So this clinical examination is very simple and easy to conduct and mostly practical. So first thing what we are checking in physical examination means physical signs. Physical signs means we are checking here some specific and many non-specific associated with malnutrition. So first thing, some people having malnutrition because of some specific reason and some have non-specific reason. Example like angular stomatitis, and then Bartol's spots, and then thyroid enlargement. These are like some people like physical, through the physical signs also we can find out whether the patient is malnutrition and whether it is a specific reason or a non-specific reason. And then the chief drawbacks are many deficiencies are unaccompanied by physical signs. Malnutrition cannot be quantified on the basis of clinical signs and biasness of the observed and observed. So what happens here, what they need to say is, through the clinical assessment or through the clinical examination we cannot find the malnutrition or through the whether patient is having this angular stomatitis or a thyroid enlargement like that. So what happens that time, sometimes this clinical signs cannot be very effective to find out the nutritional status. The next one is when two or more nut deficiency signs are present, the diagnostic significance is enhanced. Means whether there are two or more nutritional deficiencies, that is nutritional deficiency signs are present, like any nutritional deficiency more than two are present, then diagnostic significance is enhanced. And then next one is the drawback are malnutrition cannot be defined only on the basis of clinical signs and lack of specifying of most signs. So what happens, drawback of this clinical examination means through the clinical examination we cannot define the malnutrition because of the clinical signs, maybe that is because of other causes as well. So there is a drawback of clinical examination method. The next one is anthropometry. Anthropometry also a method of nutritional assessment. So in anthropometry, what we does is, that is height of the patient, weight, skin fold thickness, and arm circumstances are valuable indicator of nutritional status. Through the height, weight, skin fold thickness, and arm circumstance can indicator of a nutritional status. Like, what is the nutritional status of the patient, we can find out through this height, weight of a individual. And next one is, in young children, chest and head circumstance are measured too. So for young children, we need to measure the children chest and head circumference are measured too. The next one is, if recordings are made for a long time, then they reflect the pattern of growth and development. Through the anthropometry, we can assess the height, weight, arm circumference. For children, we can measure the chest and head. Okay, through that we can watch, we can observe that the pattern of growth and development, whether it is a normal growth and development or it's not, that we can find. Example, mid-arm circumferences growth monitoring. So we can find out through this anthropometry method whether the pattern of growth and development is correct or not. Next one is laboratory and biochemical evaluation. Through the laboratory and biochemical evaluation also, we can assess the nutritional status. So first one is lab test. So in lab test, that is all blood tests like hemoglobin, RBCs. Okay, this useful index of overall state of nutrition. So through the RBCs and through the hemoglobin test, we can find the nutritional status, like if the patient is having any anemia. Okay, all this we can find. And then stool test. Through the stool test for intestinal parasites, if in intestine any parasites are present, or history of parasitic infections, okay, or chronic dysentery, this also we can find through the stool test. And then next one is urine test. For aluminum and sugar test we can do. So this and all laboratory test, through this also we can assess the nutritional status. And then next one is biochemical test, that is expensive and time consuming. So this reveal current nutritional status, so reveals. So through the biochemical test also we can find the nutritional status. And some of the tests are protein, fluoride, vitamin A, niacin. This test we can do through the biochemical test, and we can find the nutritional status result. And then next one is radiological examination. So radiological examination, that is routinely not carried out. Mainly this radiological examination routinely it not carried out. But if the clinical signs indicate appreciable incidence of rickets, okay, that is the deficiency, rickets or osteomyelitis or infantile survey or very this and all the vitamin deficiencies, if anything in this present, then we can carry it out through radiological examination. Such studies will reveal the degree of incidence of mild form, like how much it is affected. Through the radiological examination we can find out if at all they have any signs of these vitamin deficiencies. The next one is functional assessment. In functional assessment, this is also a method of nutritional assessment. So in this, what they do is, the main purpose of this test are to assess the degree of alteration in physical functions associated with under and malnutrition. So through the functional assessment, the main purpose of this functional assessment means degree of alterations of physiological functions. Okay, because of malnutrition, if there is any present of physiological functions alteration is there, like their walking style or anything physiological alteration is there, so through the functions we can find out whether the patient is having malnutrition or not. That nutritional status we can find out. The next one is functional incense of nutritional status are emerging as an important class of diagnostic tools. So through the functional assessment of physical assessment, what we can know any nutritional status, is it important to diagnose or not. Okay, that we can find out through the functional assessment. The next one is assessment of dietary intake. So this is also a method of nutritional assessment to know the nutritional status. So what we are doing in this means we are assessing the dietary intake, means how much food they are consuming and what is the diet they are taking. Like food consumption means what food they are taking, how much they are taking. So 24 hours food frequency and household inquiries. So in 24 hours how much food intake they have, that we are checking or assessing. The next one is dietary survey. In dietary survey, like household inquiries or individual food consumption, which includes like what kind of food they are taking. Dietary survey we are doing in house, we are inquiring like what kind of food they are taking. Like example, like weaning of raw food, like how much raw food they are taking, it is practicable and if properly carried out is very accurate, like how much they are intaking or what is the accurate food they are taking. Okay, that measurement. And all food that is eaten or discarried is also weighted, like what kind of food they have taken eating. Okay, and discarried is also weighted, like what they are not taking, that also usually we are assessing. Then usually carried out for 1 to 21 days but commonly done for 7 days, also called on dietary cycle. So in 1 to 21 days, mainly in done for 7 days. So what is the, like what food they are taking in these 7 days, that is called dietary cycle. The next one is vital and health statistics. So next one, there we have to check their vitals and health statistic. In this analysis of mortality and morbidity data will defining groups of high risk and indicates the extent of risk to the community. So through the vital and health statistic we can find out the in a community when the patient is staying whether they have any high risk factors. Okay, we can identify through their group mortality rate and morbidity rate. Mortality means the death rate, and the morbidity birth rate we can find out through their community vital health statistic. And mortality is age group like 1 to 4 years related to malnutrition. Example, through the health statistic we can find like example like 1 to 4 years related children's their mortality rate is for the malnutrition. And next one is data on morbidity, means in hospital data or data from community, whether it is hospital data or in a community data, we can find out that protein energy malnutrition. Okay, how many patients are, like this is morbidity means death rate, disease rate. Okay, so because of hospital data or community data we can relation to protein energy malnutrition, how many patients are getting, and anemia. Okay, and xerophthalmia, this is eye Vitamin deficiency can be of value to provide additional information about the nutritional status of a community ecological studies. So we can find through the vital and health statistic, we can find what is the morbidity and mortality rate of a community. And next one is food balance sheet. So food balance sheet is supplies are related to census population to derive level of food consumption in term of per capita supply available. So what happens, like through the census duty, what we will know means the population, how much population, how, what is the level of food consumption, how much food they are taking as for the capital supply in availability, like how much food balance it means in a population, how much food is supplied or how much food consumptions are available. And then next one is it gives an indications of general pattern of food consumption in a country. So in a country, how much food consumption or how much food they are providing, that also we can find out through the balance, food balance sheet. And then next one is, next method is ecological studies. This is also a method of nutritional assessment. Ecological sheet means mainly food balance sheet. What I said means in a population what is the level of food consumption, okay, and then generally what is like how much food is providing to a country in indication of general pattern. And then next one is health and education service. So health and education service mainly primary healthcare service and feeding and immunization programs. Through this also we can assess the nutritional status. And then conditioning the influences like parasitic bacteria or viral infection which precipitate malnutrition among the community. If in a community, if anything viral infections, bacterial infections are there, that can also affect the nutritional status and the patient can have malnutrition if their community is affected with viral infections. Then next one, last one is socio-economic factor. Through the socio-economic factor also we can assess the nutritional status like size, family size, whether they are staying in a joint family or a small family, as for that, and then occupations and the income and education, custom and cultural pattern in relation to finding practice of children, mother, etc. So when we are assessing the socio-economical factor, whether what is the family situation, like the size of the family, and in a family what is the occupation they are doing, and what is their income, and what is the education custom they are following, and the culture they are following, as for that also we can assess the nutritional status. And then next one is food consumption pattern are likely to vary among various socio-economical group. So as everyone knows, in a socio-economical group, and there are different types of socio-economical group. As for their group, their food intake or food consumption pattern also different. So as for that also we can assess the nutritional status of a individual. This is all about the assessment of nutritional status. So nutritional assessment, so this is all coming under the nutritional assessment. Thank you.